Hello, everyone. I am Liz Sorani, Director of Research at the Friedreich Ataxia Research Alliance. I'm joined here by Lauren Moore, Chief Scientific Officer at the National Ataxia Foundation. And we are happy to share with you that hereditary ataxia has been once again added to the peer-reviewed medical research program for the year 2024. And this is one of the special interest programs managed by the Congressional Directed Medical Research Programs, or CDMRP. And this was possible through the combined effort of FARA, NAF, and members of the ataxia community. All are great advocates. But before I introduce the speaker, I want to point out that it is not guaranteed that hereditary ataxia is in the program every year. And if we want this funding opportunity to be available to the ataxia research community, we need to make a request every year. And for this reason, it is very important that you reach out to us, myself, Lauren, anybody at FARA or NAF, and let us know if you apply. So we can include this information when we make a request next year. This is a very impactful statistics, and we can include it in the future requests, future appropriation requests. Dr. Argue, our speaker today, will take questions at the end of the presentation. You can type them in the Q&A box at any time during the seminar. We'll read them at the end. After the Q&A session, we'll have another panel with a panel session with PIs who were awarded a CDMRP grant in past years. So don't log out at the end of Dr. Argue's talk. And we'll hear tips from them, from the investigators who went through the process successfully in the past. The webinar is recorded, and we will share the link to access it. Now it is my pleasure to introduce Dr. Catherine Argue. Dr. Argue is the Deputy Program Manager for the Peer Review Medical Research Program and is responsible for the execution of the program lifecycle that includes annual investment strategy, program announcement, application review, funding of awards, and oversight of research progress. Dr. Argue obtained her PhD in pharmacological and physiological sciences from St. Louis University School of Medicine and went on to do a postdoc focusing on developmental neuroendocrinology and worked on model of autism. This is a great opportunity to hear about the program. We're very grateful to Dr. Argue for her time. So please take advantage of the opportunity and ask all the questions you have. We will have plenty of time at the end of the presentation. And with that, Dr. Argue, the floor is yours.
All right, thank you so much, Liz. Just give me a moment here and I will get the slide deck up and running. There we go. Hopefully you can all see the slides now.
Yeah, looks good.
So, all right, thank you. It is my absolute pleasure to be here today to tell you a little bit more about the program and the funding opportunities that we will have for FY24. As Liz said, I am the Deputy Program Manager for the Peer-Reviewed Medical Research Program. All right, so this is just a little bit of an overview about what I'll be talking about today. We're going to start with an overview of the Congressionally Directed Medical Research Programs, or CDMRP, as a whole. And we'll talk about the program cycle and review process that is common to all CDMRP programs. And then we'll go into the specifics of the peer-reviewed medical research program, which has the funding opportunities this year for hereditary ataxia. We'll talk about the opportunities that we put out for FY24 and the application process, and also give you some tips for a successful application. The overall vision of CDMRP is to transform healthcare through innovative and impactful research. And you're going to see the terms innovative and impactful throughout the slideshow today. So we really take this to heart that we want to find impactful research. We don't want to fund just research for research's sake. We want to fund research that is going to make a difference in patients' lives. And so that's kind of reiterated throughout several things that you're going to see today. And we hope that you'll keep that in mind as you're drafting your applications to us. We do this through our mission, which is to responsibly manage collaborative research that discovers, develops, and delivers healthcare solutions for service members, their families, veterans, and the American public. So I want to highlight the last part of that sentence about the service members, their families, veterans, and the American public. All of these groups, this is altogether what comprises the military health system. It's not limited just to the active duty service members. Rather, it speaks to the service members, knowing that they're going to be taken care of after their service completes, as well as knowing that their families and friends are safe and healthy back at home. This is what we refer to as the CDMRP star graphic. It's the who, the what, the where, and the how of CDMRP. So just for those of you who may not already be familiar, CDMRP was first started in 1992, and it's really stood up on the shoulders of grassroots efforts from a group of breast cancer advocates that went to the Hill and lobbied for funds for breast cancer research. And they received their appropriation, but with the appropriation, what they wanted was for it to be managed differently. They didn't want the same things that had already been funded for breast cancer to still continue being funded. They wanted to make a change, and they wanted to have a voice at the table, a seat at the table of making the funding decisions. So after they had their appropriation, they went to NIH and NSF and some of the other, common players for federal funding, and everyone was happy to take the appropriation and fund research for breast cancer. However, it was the commanding general of the Medical Research and Development Command under the U.S. Army that told them that they would set up a process that would allow the advocates themselves to have a seat at the table. Everyone else just kind of wanted to stick with their same old process of how they had been making funding decisions up until that point. So that is how CDMRP was first started under the Department of Defense. And as I said, it's all about funding innovative and impactful research. Another thing that's a little bit different from us, for us than other funding organizations, is that we can fund anywhere in the world. So we're not just limited to funding investigators within the United States. And you'll hear more about our two-tier review process that includes scientists, clinicians, and consumers throughout the review process later on in the slide deck. Just a few more hallmarks and information about CDMRP. It's really important to note that the funds that we have are added by Congress to the DoD budget. We do not request these funds. No one at the program office is asking for funds. And it's really the same as CDMRP was first started. It's based on advocacy and lobbying efforts to see what programs and what topic areas come under CDMRP and the appropriation amount that they will receive. So since we're receiving these funds from Congress on an annual basis, all of our awards are fully obligated upfront because we don't want our awardees to have the worry of what's going to change in the upcoming year when new congressional language is received. So if you apply for a 4-year award, you will receive the full funding for all 4 years up at the awards start, right at the beginning. And as I already mentioned, we integrate consumers throughout all of the program process, and most importantly, throughout the funding recommendations process in CDMRP. And we collaborate with other funding organizations. We have excellent relationships with NIH and NSF and the CDC and the VA, as well as many others. But what we really want to do is to be complementary to their efforts, not duplicative. So please keep in mind that if you submit the same proposal to us as to another funding organization and you're fortunate enough to have both recommended for funding, you will need to make a decision on which one you want to accept. We cannot fund the exact same research as another funding organization. We annually adapt our strategy based on the congressional language that we receive every year. So it does change a bit year to year. As you can see, hereditary ataxia has been a topic just for the past 2 years. And so we change that strategy every year to adapt to the new language and new topic areas that we receive. It's also important to note that all of our funding opportunities are openly and publicly competed. So we do not have continuation of funding mechanisms. Every way of getting funding that we have is through open and fair competition. And also important for this is to note that we don't do individual consultation with applicants. Once our program announcements go out, we really try to limit our communications to broad webinars like this, where we can make sure that all applicants are receiving the exact same information and everyone has the same chance of getting funded without anyone being seen as being given a competitive advantage. And again, remember that impact is of the utmost importance here. We want to make sure that the research that we're funding is going to bring health and quality of life to those that are affected by the disease or condition. This is the full list of the 35 CDMRP programs that Congress listed for FY24. You can see there's two brand new programs, arthritis and glioblastoma, and then highlighted over in yellow, that will be the focus of the presentation today, is the peer-reviewed medical research program with 42 topic areas. It is the largest of the CDMRP programs with an appropriation this year of $370 million. Just a few more notes. I know I brought up at the beginning when we talked about the mission, kind of the broad definition that we used for military health, and it's not limited just to the service members. For CDMRP applications, since they are coming in under the Department of Defense, you do need to write statements that will address the military relevance of the research that you're proposing. And this slide just gives you a couple of ideas of how you can do that based on whether you're working on a topic area that affects active duty service members themselves, a condition that is maybe disqualifying for service, or a topic area that's going to strongly affect the veteran community or even the family members of somebody who might be serving in the military. So what we advise you to do is that if you're struggling to come up with the military relevance piece, a good source of information can be one, just to do your homework, look at incidence rates and do a bit of research on the military, but also to have a good, strong connection with the advocacy group and maybe ask them for some ideas, because they usually have some really good statistics on the disease and condition, and especially if they played a role in getting it under this line of funding for the program, they have good justification for military relevance for the topic area. So now we'll move into the program cycle and review process. This is the overall program cycle kind of timeline slide. And all of our funding opportunities are released following the signature of the DoD appropriations bill. So you will note things were a bit delayed this year due to the continuing resolutions. Since we are dependent upon that annual appropriation from Congress, we cannot release funding opportunities until we have the signed DoD bill. As soon as the funding opportunities are released, it's important to note that all of our applications have a pre-application type. It will either be a letter of intent, which is just a simple one-pager, or a more involved pre-application that will be screened. We'll go through which mechanisms require which type, but every single award mechanism is going to have some type of pre-application required. We do not accept any full applications without a pre-application. So make sure you do not miss the deadline for that pre-application step.
It looks like we lost Catherine. Hold on, everyone. Let me see. Yeah, hold on, everyone. Let me see if I can get Catherine back. Oh, there you go. You're back.
There I am. Am I back? Oh my gosh, I am
Yes.
so sorry. The connection just dropped. Part of the fun of the virtual environment.
That's right.
Let me get
No
my slides
problem.
back up.
Yeah, yeah.
Glad it came back pretty quickly. All right, and did you hear the start of this slide at least?
Yes, we did. Yeah.
Okay. All right, so picking up with the pre-applications, we're using those for program planning purposes to plan our peer review panels, and then there are the handful of those that are going to be screened. Once we have the full applications in, they're going to move to our two-tier peer review system, starting with peer review and then followed by programmatic review, which I'll be explaining further in just a bit. And then we move to the funding recommendations, and it's the commanding general of MRDC, the Medical Research Development Command, that is the approval authority for the recommended for funding list. So please note it will be quite some length of time between submitting your pre-application and getting notice that you have been of recommended for funding status is. We are anticipating our kind of last batch of applicants for FY24 being notified probably around January. So you have close to a year almost to wait to find out what that is. So just keep that in mind with your planning. All right, so here's about our two-tier review process. We start out with peer review, which, as I mentioned, we do not have standing peer review panels, but we try to assemble the best panels that we can every year to really address the specific areas being studied in the applications that we receive. And another thing that's different about our peer review process is that there's absolutely no comparison of applications during peer review. Instead, what we're asking our peer review panels to do is to compare the application that they're looking at against an idealized application. So it's giving an absolute scientific merit score. And this is important because although you'll receive your summary statements that have the strengths and weaknesses as well as your peer review score does not really give you an idea of your standing relative to others. It's just an absolute scientific merit score, and you do have to wait to find out whether or not that's really your application was competitive until it goes through the second tier of review, which is programmatic review. In theory, for a peer review panel, they could have all really excellent proposals and score everything, pretty close to a 1. So we don't ask them to really spread the scores or anything like that. So it is common that something with a high, really good seeming peer review score doesn't necessarily mean it'll get recommended for funding. We also do not take a strict pay line cut based off of the peer review score. Once applications go to the second tier of review, which is the programmatic review, they're going to look very heavily at all of the strengths and weaknesses that were pointed out by the peer reviewers, but they're also really going to be doing that comparison-based review, which one do we like better than which other one? And they're also going to be taking into account additional criteria, such as the overall program intent, program relevance, the specific award mechanism that you applied to, and relative impact. So following programmatic review, that's when you'll get the notice of whether or not your application was recommended for funding. And it's important to note that we're involving consumers. These are patient advocates, those with lived experience with the disease or condition. So they can be patients or they can be caregivers for patients, anyone that can speak to that patient perspective. And they are full voting members of both the peer and programmatic review meetings. They have a full voice in making the funding decisions, as was the intent of setting up CDMRP. And we also involve them even before peer review during our vision setting when we're deciding what program announcements to put out. And you'll notice for the peer-reviewed medical research program, we have strategic goals, and the consumers involved with the program have a voice in what strategic goals are going to be offered. So now we'll move into the specifics of the peer-reviewed medical research program. This is the vision and the mission of the program, which is to improve the healthcare and well-being of all military service members, veterans, and their families. And we do this through encouraging, identifying, selecting, and managing medical research projects of clear scientific merit that lead to impactful advances in the healthcare of service members, veterans, and their families. So the PRMRP program was first initiated in 1999, and relative to some other CDMRP programs that are focused on a single disease or condition, the PRMRP's congressional language is fairly general. All it says is that we should support research of clear scientific merit and direct relevance to military health in specified topic areas, and then it lists the topic areas. It does not give us anything more prescriptive than that. This is the full list of the 42 topic areas that the program received for FY24. You'll see hereditary ataxia up at the top of the middle column here. And I also want to point out that we did have 4 new topic areas for FY24, topics that have never before been assigned to the program. They are accelerated aging processes associated with the military, computational biology for precision health, congenital cytomegalovirus, and FAR-UBC germicidal. To deal with the diversity of the topic areas that we have, as well as the variability in topic areas from year to year, we take a portfolio-driven approach to organize our topic areas into portfolios based on common research areas, common physiological systems. Really, we're trying to group them in a way where we can put them together to group together the topic areas where there's going to be common needs of the patient communities. So hereditary ataxia is grouped into our rare diseases and conditions portfolio. And where the portfolio assignment is really important is that we organize strategic goals at the portfolio level. So within our program announcements, you'll see the portfolio listed, and then you'll see the topic areas, and then you'll see a list of strategic goals for that portfolio. And those goals are going to be aligned to the continuum of care. So you'll have goals under foundational studies, prevention, diagnosis, treatment, and epidemiology. And you must select one topic area and then one strategic goal on which your application is going to be focused. This slide, I'm going to be giving a lot more detail on the individual funding opportunities that we have for FY23 in just a few slides. This is giving you a little bit of a preview of the 6 that we have for this year. And really the intent of this slide is just to highlight that we're covering the full spectrum of research from basic all the way up through and including clinical trials, and that we are doing this for all portfolios. So all funding opportunities are offered to all portfolios and hence all topic areas. All right, and then this is showing you the specific strategic goals for the rare diseases and conditions portfolio under which hereditary ataxia falls. We have 3 goals for foundational studies, 3 for diagnosis, and then we have 4 for treatment and 4 for epidemiology. And I know I'm not giving you enough time to read these goals here today. They are listed in the program announcements. I'll also be sharing my slides at the end so that they can be sent out to all of those that registered for this webinar. But really what I wanted to highlight here, rather than getting into the specifics of the goals, is just to mention that the goals are meant to be fairly general so that they're not really specific to just one topic area under the portfolio. You should be able to take a mix and match approach where several topic areas are applicable to several different strategic goals and vice versa. All right, so here's where we'll get into the specific award mechanisms that we put out for FY24. The first 2 are geared towards basic research. That is the Discovery Award. The Discovery Award is what we refer to as our high-risk, high-reward mechanism. It's for really a novel, innovative line of research, not a continuation of funding for something that has already been being worked on in the lab. So no preliminary data is allowed for this award mechanism. It's really just to get a new idea off the ground. And like for all of our award mechanisms, impact is really important. We want to make sure that, if this were successful, even though these are high risk, that if it were successful, it would be really high reward and may really be a game changer for the people affected by the disease or condition. Next, we have our Investigator-Initiated Research Award. This is for your classic kind of hypothesis-driven validation studies. We did change this award mechanism from what had been offered in previous years. It used to be offered for anything from basic all the way up through translational research. So Now we're limiting it to just basic research, and we're really looking for those validation studies to elaborate upon and gather more preliminary data and really show the kind of the meat behind, the idea, and really get it ready to move into a more translational stage of research by demonstrating, in maybe specific disease models or something along those lines. Then moving into translational research, we have the Impact Award. This is a new award mechanism for the year. And what this is designed to do is to take basic research towards the clinic. And so we do have a partnering option for this award mechanism. It's $2 million if you come in as a single investigator, or $2.6 million direct cost limit if you come in with a partner, but the partner must be a clinician. So this is really looking at taking it to that next stage of translation, of partnering with a clinician and finding out really what the best models are to make sure that it's going to be relevant and applicable to the patient community that you're trying to affect. Then also under translational research, we have the Technology and Therapeutic Development Award mechanism. This one is not really a hypothesis-driven award mechanism. Instead, it is a product-driven award mechanism, or if we refer to it as our IND or IDE enabling award mechanism. It doesn't have to be used for that. It can be used for any sort of final stages of preclinical research that need to be done before something can get to a first-in-human clinical trial. Then we move into our clinical research and clinical trial mechanisms. The first is the Lifestyle and Behavioral Health Interventions Research Award. This award mechanism is specific to human research. No animal studies allowed under this award mechanism. But if a clinical trial is proposed, it must be for a non-pharmacological therapy or a non-invasive device. We're thinking about things like exercise or dietary recommendations, those types of things. Otherwise, it can be used for clinical research, so epidemiology type studies, any type of a retrospective patient data study that someone would like to propose. And then we lastly have our clinical trial award mechanism, which is for interventional clinical trials for any type of intervention, really. It can be a pharmacological item, it can be a larger scale item for any sort for a lifestyle type intervention, or it can be for a diagnostic or a device. Anything really that needs to be tested in a human population is open here. So the first 5 of these award mechanisms, the Discovery Award through the Lifestyle and Behavioral Health Interventions Research Award, those all just have a simple one-page letter of intent for the pre-application type. However, for the clinical trial award mechanism, that one is a pre-proposal that will be screened, and you have to wait for a letter of invitation before you move forward with submitting the full proposal. This is just a snapshot showing you the first 2 pages from one of our program announcements, so you can see where to find some really important information. Right there on the very first page, you can see the submission dates and times. And then also on the table of contents, I want to point out 2 pieces that you should really look at to get at the intent of the award mechanism and to help you make the decision in which of the award mechanisms is the best fit for the research you're going to be proposing. So we have the award information section, and also under the criteria section, there's really specific peer review criteria for each of our mechanisms. And looking over the criteria by which you will be evaluated is going to help give you a really good idea of what we're looking at. This is a snapshot of our peer review criteria. It's actually showing the impact criteria from the Discovery Award application this year. So you can see with that being our high risk, high reward mechanism for something that's never before been tested, we have criteria such as to what extent the research has the potential to generate preliminary data. It really tells you exactly what we're looking for in that award mechanism and how you will be evaluated. Also, pay attention to the ordering of the peer review criteria. It's not always in the same order. In fact, research and strategy and feasibility is usually not our topmost scored criteria. We usually weight impact higher, and for this Discovery Award mechanism, innovation is also ranked very highly. So the ordering of the criteria are usually in descending order of importance. All right, and then this is showing a snapshot of the programmatic review criteria. Unlike the peer review criteria, the programmatic review criteria do not vary from mechanism to mechanism. What I want to point out here is that we do have the programmatic panel listed on our website. I encourage you to take a look at the folks that are on the programmatic panel. You can get an idea of what fields their expertise is in. They are all scientists and clinicians. We do also involve consumers as ad hoc reviewers, but keep in mind that even though they are in the scientific or medical field, they might not be in your exact same field. So you want to make sure that your application is understandable to more of a general audience. And then this chart is just a helpful one for you to save once I send out the slides, and it lists all of our award mechanisms with the submission deadlines, and it also specifies those pre-application types. So all of our pre-application deadlines are fast approaching with the beginning to middle of May. And then the full application deadlines range from the end of May to the middle of August. Keep in mind for that clinical trial award, you do have to wait to receive the letter of invitation before you proceed with submitting the full application. This is just a snapshot of the application process overview, keeping in mind that there are rules for just the PI as well as the business official at your organization throughout. So I want to highlight that the pre-application process is going to happen in grants.gov, whereas as long as you're an extramural non-DoD entity, your full application is going to happen in grants.gov rather than eBRAP. So intramural DoD labs are going to submit their full applications in eBRAP. However, there's absolutely no competitive advantage to submitting through eBRAP versus grants.gov. They all get pulled together at the end. Then I also want to highlight that we do offer a verification period. So after the full application submission deadline, there's a brief verify application period where you can go in and double check that everything was submitted properly. However, do note that you cannot change the proposal narrative or the budget during the verify application period. So you have to make sure that those are accurate prior to that deadline. All right, and now we'll just conclude with some tips for success. And the biggest tip that I can give is to read the announcement really carefully. It's a very dense document. We're well aware that it is a really dense document and it will take you some time to get through. You may even want to read through it more than once. But this is really our place to tell you absolutely everything that the program is asking for. So we always get questions of, oh, what about this idea? Would this be applicable? Everything that you need to figure out whether or not your research fits within that award mechanism, what the strategic goals are, all of that should be within the program announcement. So make sure that you read carefully and make sure that you're paying attention to all of the necessary items that you need to include in your application. There's a long list of attachments, all with very specific instructions of what they should include. And then also, I really think, relevance and impact kind of go hand in hand together to make sure that you're showing relevance to everything that the program is asking for, relevance to the strategic goals, relevance to the topic area. And along with those, you want to be showing that you have impact towards the strategic goal and the topic area. So clearly articulate how the work will make a difference for the patients that are affected by the disease and condition. Keep innovation in mind. Some of our award mechanisms do weight innovation very highly. And then also make sure that you're clearly addressing feasibility. So even if it's a mechanism that does not allow preliminary data, you can still show that you have the appropriate resources in terms of all of the equipment you will need and the proper personnel chosen for the project to demonstrate that you can do what you're proposing. All right, planning and timelines. I cannot emphasize the strictness of our timelines enough. We do not offer grace periods on the submission deadline. So if it says something is due by 5 p.m., it really means 5 p.m. on the dot. If it comes in at 5:01, we unfortunately cannot accept it. So this means that you should plan for technical difficulties. Obviously, I just had one now where my Zoom disconnected for a minute. That could happen when you're uploading your documents where, things kind of get disconnected for a minute and it takes a few minutes longer than you were originally anticipating. So make sure you plan in advance for any potential technical difficulties and make sure that you're going to be able to get it submitted by the deadline. And then also grantsmanship. Keep in mind that there's going to be specific attachments that we ask for you to write in lay language. This is in keeping in mind our consumer or patient advocate reviewers. So you want to make sure that you're really writing those in language where they'll be clearly able to understand. And then you also want to be able to speak to a sort of a general scientific audience, since when it gets to the programmatic review stage, it may not be individuals within your very specific field looking at it. This is just showing a snapshot of the peer-reviewed medical landing page. You can see here where we have the programmatic panel members listed. And I also encourage you to take a look at last year's recommended for funding lists. So you can see what types of applications we were funding, as well as what the success rates were for our various award mechanisms. So we have the percent of applications that were recommended for funding broken down by all of the different award mechanisms, as well as by topic area. And then this is just reminding you, if you have not done so already, to make sure that you sign up to be on CDMRP's listserv for email communications so that you do not miss out on announcements of new funding opportunities. You can sign up either through the CDMRP website or through eBrep. They both take you to the same listserv. And then in addition to this webinar that I'm giving today, there are also some webinars on the CDMRP website that are really helpful. It'll be a lot of the same information, but said in a different way. So always helpful to get it in as many different ways as you can, like the high risk, high gain funding opportunities that might be really helpful if you're thinking about the discovery award mechanism. There's some that are specific for clinical research and clinical trial opportunities. So I really encourage you to take a look at that. All right, so that includes the slide deck that I had for you all. I'm going to stop sharing my screen and I'll go ahead and start working through the questions that I see you all have been putting in the chat.
Yeah, there's quite a few. Let me read them from you. First one is, what if the proposal that we have addresses two strategic goals? Should we mention in the application both of them, even though we need to pick one?
So it's really going to be weighted based on the one that you chose. If you'll notice, the peer review criteria is written as, how well the proposed research aligns to the PI selected strategic goal. I believe that's how we wrote it in the PI, in the peer review criteria. So we're really only going to be assessed for that one that you chose when you clicked the button. But of course, it does not hurt to mention another one. If you want to kind of also add that in there, you can of course mention it.
Great. Then next one is the PRMRP open to biotechs. Maybe you can expand on who's eligible, international, ex-US, etc.
Yes. So both international as well as internal to the US are both eligible to apply. We can fund both for-profit and nonprofit organizations. So biotech is certainly welcome.
There's a technical question. What if we are not registered with SAM.gov? Is there a sufficient time to get UEI before June 6th? UEI number.
I believe there should still be time before the deadline to get the UEI number. However, I would recommend reaching out directly to the folks at SAM.gov because that one's a little bit outside of my control, and I don't know if there's anything going on at this time that might be delaying that process.
Okay. Let's see, this is a step 2 in grants.gov. The PO to log in and begin the application, and then invites the PI to submit the relevant information through the workspace. Is this correct?
I believe that is how it works. However, to be honest, I have never actually done the submission process myself, but I believe that is in theory how it is supposed to work. Maybe that would be a good one to double check with the panel that you're going to have afterwards, which is the folks that have gone through the submission process.
Yeah, it's a good question for them. And then what are the rules for equipment? It states that encourage institute to make equipment available. If you need an instrument like a confocal microscope, can we ask for it?
Yes, you can certainly ask for equipment purchases. So there is a line item on the budget for equipment. You just have to justify, the equipment, make sure it's necessary for this project. Depending on the cost of it, that's something that will be worked out during negotiations, whether or not we can cover the full cost of it, or might ask that you split it amongst other funding sources. But you can certainly request equipment. That is allowed.
Great. Also, they'd like a confirmation that the PI cannot submit to grants.gov and it must be done by a BO. Maybe that's another question for the panel later.
Yes, so I think that's coming from, the slide shows that the business official is going to be the one to actually submit in grants.gov, which yes, it is. The business official is going to be the one to actually do that submission and hit the submit button there. So that's why we have that verification step too, where the PI can kind of go back and, see that everything that the business official did was done correctly.
Next, how do we make sure that a European organization has an agreement with the government for indirect cost level and also for the UEI number?
So the UEI number you're going to register for at sam.gov. I believe there's instructions for that within the program announcement and application instructions packet. It does give you instructions in there for registering for the UEI number. And then regarding the indirect cost levels, we do have a de minimis rate that we use if you do not have a negotiated rate. However, if you've received, have historical history of federal funding, you can, establish a process to register for a specific rate and negotiate one.
Yeah, this is on IP. Can a biotech retain full rights to its IP if a drug is being developed?
Yes, so we work under the Bayh-Dole Act. So the IP rights are retained by the grantee. They're not retained by the government. So biotech would retain those rights.
I think it's kind of similar, but to the same line, along the same lines. For-profit entities, is the grant consider 100% non-dilutive funding?
Non-dilutive funding, yes. So I mean, we're not taking on any rights to anything by offering the funding. So
how do we know if we have a negotiated rate? Is there a list?
I would believe it would be associated with your sam.gov registration, but to be honest, I'm not positive if those lists, if that's all publicly disclosed. I don't think it is. So I think you would have to work with your business official there to find out what your negotiated rate is.
I see something in the chat. There's one in the chat. Does alternate status imply the application was highly competitive? Does it play any role in resubmission?
So we do not have a formal resubmission process. I'm guessing that we did have some individuals from FY23 that were listed as alternates, and it's now coming up on FY24. Those FY23 alternates still do have a chance of being picked up for funding under FY23. So we have all of the way until September 30th of 2025 to finish with FY23. So I would encourage you, if you were listed as an alternate, to still go ahead and submit for FY24, because it wasn't It's not a guarantee of funding, but there is still a chance. However, we don't have a resubmission process, so it will be reviewed as a new submission for FY24.
Okay, I don't see any more questions. Maybe I will ask one. What are the most common mistakes, non-compliance mistake when somebody submits the application? You're very thorough in making sure that the application is non-compliant. So are there
Yes.
top 2 or 3 that people should be aware of?
So one of the top ones is making mistakes on that budget form that cause you to be over the allowed direct cost maximum kind of thing. Remember that budget form cannot be changed during the verification period. So make sure you're checking ahead of time to make sure that you're within any stated direct cost limits. The other thing that we have a lot of times is partnering applications, making sure both the initiating as well as the partnering PI complete all of their steps, because if you go in as a partnering application and at the end of the day we don't have information for 2 PIs, that would result in a withdrawal. The other common one is just paying attention to rules, like I mentioned, for our lifestyle and behavioral health interventions. Having animal studies proposed in that is not allowed. And for any of the basic or translational research projects, proposing a clinical trial under those is not allowed. So those commonly result in noncompliance and withdrawal.
And finally, just a clarification, maybe I missed it on when we were talking about the timing. So the awards are announced, for the past couple of years at the end of the year or beginning of the following year. What about funding? What are the funding dispersed? Just to give an idea to people.
Yes. So from the time that if you look at the program announcement for the mechanism you're thinking about, if you take the programmatic review date, it's kind of about a month after that programmatic review date that we'll generally be have all the letters ready to go and start sending those out. After you receive your recommended for funding letter, the negotiations process generally takes about 90 days. So that is the earliest possible start date that you would have. And that assumes that everything was kind of very easily in order, no revised documents are needed. That's the time where things like your indirect cost rate is going to be worked out, equipment purchases, all of those types of things are going to be evaluated and all of that. So that takes about 90 days.
Great. Okay, one last chance if you have questions. Otherwise, I'd like to thank Dr. Argy again for her time today. Oh, there's another question. 2, actually. So we'll take them. How easy is to change institution? I'm not sure during the process.
So it does depend a little bit on where you are in the process, but the award is made to the institution. So the first thing is that you have to make sure that the institution that the award was made to is on board with relinquishing the award. So that, can sometimes be a holdup. They may not want to give that award up. They may instead want to propose a new PI if you're planning on leaving the organization. So they have to be willing to negotiate. To relinquish, assuming they're willing to relinquish and the new institution is willing to accept. Doing this during the negotiations process is fairly straightforward and very simple. During the award period of performance, it is not as simple. It involves deobligating and reobligating the funds. And so that is at the discretion of the grants officer that you'll be working with during the negotiations process and then throughout the award period of performance, whether or not they'll allow a change at that time.
And this is a question about animal experimentation, which is a kind of a touchy subject for European applications, drug application from Europe. So they need to submit an ethical application to the US, even though she's in Europe. And do we have an application proposal for that? And when does it need to be done? Since we cannot start the project until approval.
So I'm assuming this is referring to the animal ethical approval, that these two questions go together.
Right.
So this is something that can be done during the awards negotiation process, or it can be done anytime during the award period of performance. So the award can start prior to receiving the ethical approval from the Department of Defense. However, you cannot start using the funds for the animal experimentation until then. So with the negotiations process taking about 90 days, that does give you time to get all of that ethical approval in place and be ready to go at your start date. You can delay the start date if you need a little bit more time than that. And also if you have some non-animal studies that are going to happen right at the beginning of the award, other things that you need to do, you can be doing those while you work on getting the ethics approval in place.
Okay, I'm gonna give it 30 more seconds if you want to write last minute
I believe there's
question.
one more question from the chat. It just came in.
Oh, can you read it? I don't see it.
Can you clarify if non-US academics and clinicians need UEI?
To be eligible, everyone has to apply with register with sam.gov and receive that UEI number. However, non-US institutions are eligible to register there.
All right. No more questions. Let's see another one. How long does it take to get the number? I think we already addressed that, right? The UI number.
Yeah, I think it's supposed to be really a quick process, like something that can be done within a couple of days. But I would reach out to the folks at sam.gov if there's any questions about it to make sure that there's not anything delaying the process at this end, at their end.
Okay. Thank you, Dr. Argue. This was really helpful. Thank you for your time today and answering all our questions. And I will turn it over to Lauren now to lead our panel discussion.
All
Thank
right,
you
this
so
was
much.
great, everyone. Excellent questions from the group. We look forward to a lot of great applications from you all. Have a good rest of the day. Bye.
Hello, everyone. So my name is Lauren Moore. I'm the Chief Scientific Officer at the National Ataxia Foundation, and we're lucky enough to have a couple previous recipients of the award join us today to answer your questions about their experience and to provide some insight and some advice for all you folks. So I'm just going to quickly introduce the folks joining us today. So we have Joanne O'Keefe, who received a Discovery Award just in 2023 from Rush University. Dr. Mary Napriala, who received a Technology Therapeutic Development Award in 2022, and Dr. Erin Seifert, who received a Discovery Award in 2022, as well as a 2016 Investigator Initiated Award back in 2016. So thank you for joining us. I think Dr. Seifert is running just a few minutes late, but she'll be joining us soon. And so with that, I will open up questions from the group for our previous grant recipients.
I first want to say thank you, Lauren, for inviting me to be on this panel. I do want to tell everyone that this is the first time that I have applied for a I call it a DoD grant, but of course it is a CDMRP grant. So I'm very grateful for this award mechanism. And it happened more quickly than I thought. I didn't start actually receiving the dollars yet because there was a delay, as Dr. Argue mentioned, with the appropriations bill. But that's turning out to be okay because there was some overlap with my award and a pilot award that I got from my own institution, from Rush. So if there's any overlap whatsoever, you have to then, after you get the award, you have to really determine what's going to be funded by the DoD and what's going to be funded by your institution and spell that out specifically. You do state that in your application that there is overlap, but you have to go into extreme detail later on. The other thing that I wanted to mention is that those applying this year are, in a way, a little bit luckier for a discovery award, because the amount last year was $200,000 over 2 years, which was very difficult to budget for, depending on, of course, what I'm doing clinical research, but I had MRIs in there, and those were the most expensive component besides salaries. So this year it's been increased to 275, which is the same as the R21 grant mechanism, which more people are, well, those who haven't applied for a DoD grant, it's exactly the same amount as a DoD. And a lot of people will apply for both awards at the same time or in a close period of time to hedge your bets whatsoever. So I did have to withdraw because I did apply after this grant for an R21. And when I got the congratulations letter, I immediately had to withdraw that grant, even though I wanted to see the reviewer comments beforehand, but I wasn't allowed to do that.
There's a question for Dr. Navarella. Regarding the tech award, did your study include any IND enabling studies? And if so, did you work with external vendors, and how did you incorporate that in writing your grant?
So we didn't go that far in our description. We didn't have to. I think it's not required. I'm not 100% sure. I'll have to read the description again. But we didn't go that far to IND. But we did have a component in which we describe a collaboration with a pharmaceutical company. We had a support letter from pharmaceutical company stating that they will help us with the further development of any therapeutics, which will come from that project. So we had kind of I would call it a letter of intent from the pharmaceutical company to back up our plan, commercialization plan, I think it was called, this document.
There's a question that says, I read something about blinded review program, but it does not seem that we fall under this review or this rule, do we? That may be a question for Catherine. I don't know if either of you can answer that.
Yeah, I'm not sure.
Blinded review would, so what specifically are you asking about oh yeah, we don't know who we are blinded to the reviewers, of course. The same as in almost all grant review processes. But this year, I don't know if we knew who was on the panel last year. Do you remember, Merrick? I don't remember if we knew who was on the review. I think the letter of intent is to inform the DoD who they're going to invite on the panel. And since we're all here for hereditary ataxias, that's what I was applying for, or that's what I did apply for. And I do want to note that the success rate for the hereditary ataxia program for the DoD awards only, so I didn't really look up for the other grant mechanisms, was actually 4 out of 9 or 44%. So it was very good. And I could have gone in under a different mechanism because I'm studying fragile, it's a long word, fragile X tremor and tremor and ataxia syndrome. So I could have gone under fragile X, but I just thought that this would be more applicable to the wider hereditary ataxia population. And I did emphasize this, that if only, it wasn't only going to be applicable if successful for FACSTAS, but that it could be also applicable to a wide variety of hereditary ataxias. So that may be something that you might think about in your application.
So, so also in you know, a year earlier, we couldn't see the reviewers. It wasn't like an NIH panel that you can actually see who review your grants. Well, not exactly who review your grants, who is on the panel which possibly review your grant, and then you can do all the guessing game. But here it wasn't. One important thing is, and this is also in instruction, that they are community reviewers. There are non-specialists who review, and you have those comments on your comments from the reviewers. There will be actually comments by non-scientific members. So it is important to address those elements of the application which involve kind of more of a community question, like military relevance and things like that.
On that topic, we have a question for the hereditary ataxia goal. How important is the justification of the impact that our work can have on the military population versus the general population?
So, I mean, I did struggle with that at first, but I did have some friends over at the VA who've done a lot of research like this. And so basically, as Dr. Arg, you pointed out, you want to provide statistics. Okay, how prevalent is this disease, whatever your disease, what's the prevalence in the population? And then, therefore, what is the prevalence of the disease in veterans? Okay, and that, of course, goes down as you go, however rare your ataxia is. But it's also associated with the family members, and that's really important too, because in my case with FAXTAS, the carriers can have children with Fragile X syndrome. So there's an added burden that if they're carriers and they're in the military, then they may be caring for a child or a grandchild with Fragile X syndrome who is intellectual disability and autism, and is on the autism spectrum disorder for the most part, not 100%. So you do have to include that and make it broad. In my review process, there was not one mention of the military relevant that I saw. Okay, but that probably did go on at the programmatic review level, not at the scientific panel review process.
I also, you know, I have no idea how much this does influence your score, final score, but I would make sure that you put actually a thought into it, that there is not just a one generic paragraph, everything is relevant to the military, that you actually put the thought into it. Sometimes, like in our case, some technologies which you use could be used much broader than to the ataxia, and that could be, you know, military families are dealing with other diseases, and if the technology which we are developing can be used to treat other disorders, it should be brought up, because that is broadening the application of your grant application. So you have to put some thought into it, not just try to be generic, I think.
I think this question is actually more for Dr. Serrani, but does FARA have data on FA in military members and family?
Yeah, I can take that. Helen, I'll send you, we drafted a little document. We don't have a specific number, but we have a number for generally for the carrier prevalence among, you know, veterans and active military duty. And then we have a few examples of how you can answer that question of military relevance. So I'll send you the document. And if anybody wants these examples, I'm happy to share it with anybody. And also about the double, I don't know if you saw the blinded question again from Helen. So she was referring to the fact that for some application, you have to be blinded to the reviewer. So you cannot disclose who you are. So, but I don't think this applies to these applications.
This certainly did not apply in our case. So we didn't have to write the application without mentioning our lab names, preliminary data, and stuff like that. But
no, that is factored into it, into the environment of your, you know, of you and your collaborators. So it's pretty much like an NIH grant process in that regard. I've been on mostly Parkinson's disease study sections as a grant reviewer for the CDMRP program. And I've got to tell you that they do a really good job at making sure that when reviewers score, they have to fall within the guidelines that are set forward. So you can't blatantly give someone a 5, okay, and which is like right in the middle, and state, okay, there's 4 strengths in the research strategy and you only list 1 weakness. That's going to be sent back to the reviewers. So they're extremely careful that it complies with the scoring really complies with the outline for the reviewers, because we all know that we've gotten reviews back where it's like 1 weakness is listed and you like get a 7, or no weaknesses noted. So I think that that's a testament to to the peer review system here. And so in the case of the DoD, the Discovery Award, I'm sorry, no preliminary data is required, and you cannot count someone down for that, or else the program officer will come back and say, you can't do that. I did have preliminary data, so of course having some preliminary data shows feasibility, and so I don't know if mine would have gotten funded if I didn't have some preliminary. Oh, great. We have these new automated lights in our offices. So if you don't move around for a couple of minutes, you go dark. Sorry about that. It wasn't the totality eclipse or anything like that.
Any other questions from the audience for our panelists? I would just ask the general question of how did your experience preparing this grant compare to other grants that you've written in the past?
This is very similar to NIH. There is a few documents which are really different, military relevance and some specific things related to the type of the award. The format of the biosketches was identical 2 years ago. I cannot say right now. I didn't read the instructions. The other support form is slightly different, but overall, I know there's some requirements, but the process is very similar to the NIH process, the budgets, the everything. So I think the level of difficulties is the same as far as the technical application. That's at least my experience. I didn't see any big differences.
And Dr. O'Keefe?
Yeah, I would tend to agree. It's not exactly the same, but it's so easy to, your Ames page is the same. You have to have a technical abstract as well as a lay abstract. That's no big deal. You have to have the military relevance. It's not that difficult. I agree with you completely that some things are turned around a little bit in the research strategy, just a little bit though, where your innovations at the end, you have the rationale at the beginning, but it's like an R21 for this discovery grant where it's 5 pages. So plus the 1 page, page requirement or limitation, limit, if you will, for the Ames page. And the same with the letters of, recommendation, biosketches, all of that. Some people were asking questions about who submits the grant. We happen to have an excellent grants department here, and they are like, this has to be in on, everything has to be in advance so that nothing screws up. Excuse me, nothing goes awry at the last second. So do you submit the grant? No, our signing official or our grants, whoever leads there's 2 people, but in any case, they submit the grant. And then if anything, they usually catch everything so that there's like, you didn't go over on, how many, I think with the lay summary or something, there's something with how many actual sentences it could be, but that's all reviewed beforehand. But I'm at a major institution, and people who are maybe smaller ones, maybe they don't get as much grant support. So if you are from one of those institutions, and you have to do more of the work yourself, you have to actually start earlier with the submission process, obviously.
So that's the answer to the question that we had about if the business officer starts the process before and then you go in, you're saying that, you know, in your institution, the business officer did you just provided the information.
We provide all the documents, they assemble it, and it goes into grants.gov. I never went on grants.gov. I only went on eBRAP for whatever it is I had to do. I mean, my letter of intent or whatever. Now you do have to do a statement of work. So I would suggest, and it's not, for some, it probably is no big deal, but because I had overlap, it ended up being a big deal after they said congratulations, because I said that there's not many people on the, oh, there's 24. Anyway, there was some of that overlap. So then I asked for the grant to start after my pilot ended so that there would be no overlap, and that was fine. At one point, they almost asked me to kind of redo the whole IRB, not the grant, but have two separate IRBs, but for the same exact study. And then they realized that that was cumbersome and probably unnecessary, but just so that I stated what was the DoD, what this grant, what was it covering? So it didn't cover all the MRIs. The pilot covered 10 controls and 10 fax tests, etc. Some that sort of information. It took me a while, but it was not horrible. It was basically even some things that are not unscored. I was asked about later, like the percent effort of a co-I who actually runs the fax test clinic was very low because of the budgetary constraints of the, you know, the $200,000. But basically, you know, I was just able to answer that that was standard of care. So
I think this will be the case in most of the United States institutions, that we are not allowed to submit NIH grants. We are not allowed to actually submit DoD grants or any other grants. This is all done by Office of Sponsored Projects, Sponsored Project Administration, whatever it's called in a different institution. I'm not exactly sure how this works in other countries outside of the United States, and we know that there was quite a few awards made for people from outside of the United States. One thing I would like to mention, and maybe that was approached by the DoD, the only one thing which is slightly different than with NIH is the naming of the attachments and putting the attachments in exact number. I know that you really don't need to be careful because your officer, sponsored project officer does it, but you need to check it, that the attachment number agrees with what DoD CDMRP wants and that the attachment is appropriately named. They're very, very peculiar about that, so, which is not the case in NIH, yes.
So we have quite a few questions coming in. So for Dr. Naparella, on grants.gov, there is a work-share place. Did you use it with your BO or not?
Could you repeat the question? You broke up a little bit. On the grants.gov?
There is a work-share place. Did you use it with your BO or not?
No, we only communicate via email. I sent attachments, PDF attachments appropriately named and specified to which number of attachment it has to be uploaded. So once they checked them, they uploaded them, and I did not use the shared space.
Are either of you aware whether there is a template for the data management plan?
someone shared a document with me that helped me create my data management plan because it is different from the NIH. But just like off the top of my head, I apologize. I can't remember.
I don't think actually 2021 application had a data management plan. I think federal government institutionalized that later, and because we have to have them now on NIH grants. So I don't recall actually having a data management plan.
And then I understand that the statement of work is something like a Gantt chart. Is that correct?
It's a table. Statement of work in our case is a table which they provide the template actually for. And you have to list all your aims and what will be done, approximate timing, and I think it's limited to 3 pages, if I remember correctly. But it is they provide a template. It's like a table. What are you going to do?
It's really not that bad. The only reason I had to adjust mine is because of the pilot. Yeah, I mean, if you want me to share my screen, but it's just a list, and it has, this is your major task 1. Get regulatory approval if you don't have it. If you already have it, but you have to change it and modify it because you added subject numbers or whatever. You know, hiring personnel, your database development, recruitment, all of that is basically just more delineated than in an NIH grant. It's very specific, but like you said, it's a table and it's not that hard. And then you have to have your projected quarterly enrollment, but you have to have that anyway for almost every grant that you write. Same thing, I looked over my reviews just in preparation for this today. And one person commented that I didn't, it was not a major weakness, but I wasn't clear how enrollment diversity was going to be addressed. Actually, this person said it was a major weakness. So I'm sorry, but and I usually, now I'm going to go back because I think a lot of times, even when you don't get a grant, obviously you're going to look back on the weaknesses and then on your next try, not have any of those. But usually I list the population in at least the 5-state region that our clinic recruits from, that would be feasible to recruit ethnic minorities.
Any other questions from the audience members about either the application process, or we can also ask questions about their experience once the grant is received and perhaps reporting requirements of the grant. I think that also would be an interesting topic to go into. Yeah, what has the reporting requirements been comparable to other grants that you've received in the past? Is it more extensive reporting?
It seems so. My first report is due on, so there is always a delay between the start because there's a lot of regulatory elements. So from the moment you find out from the grant about the grant, at least in my case, was about 4 months. And I'm right now due with the first report at the end of May. So I did not start it yet, but I know the forms. I got contacted officer, I got the forms, and they are more extensive, significantly more extensive, seem to be than a standard. If anybody is familiar with NIH, the RPPR type of reporting, it's really limited to answering a few questions, 2 pages of a summary of achievements and plans for a future work, repeating specific aims, and really a few other not critical questions. So it's fairly simple in case of NIH. This seemed to be more involved. So, but I don't know exactly yet.
I see that Dr. Seifert has joined us. Perhaps you can answer this question since you also received a 2016 award. So the question is, how have the reporting requirements compared for this grant compared to other grants that you've received in the past?
Yeah, so I think I might be echoing what Marek just said. It's an unlimited, so this is for the progress report, the RPPR equivalent. So it's an unlimited number of pages, and they expect almost like a manuscript. So it doesn't have to be a finished manuscript, but they expect a high level of detail, you know, with a narrative description of the results, with your figures well labeled. I mean, the figures can be, you know, at an intermediate step of the research, that's fine, but it should be all very carefully labeled. And it took quite a bit of time because, you know, then you start to feel a little bit of pressure to really do that quite well, to present that quite well to the program officer. And they also want it to be in reference to the statement of work. So that statement of work that will get generated, you should have that very clear in your mind. They almost run these things like a contract. And each statement of work, you're going to want to address those. So if you could easily go through that and then link the data that you have, anything you've tried, to the statement of work, that will really be the easiest for you. I didn't always do that as carefully for the RPPR, but for the final one, I actually had my final report rejected. So I sent them quite a beefy report. And then they said, no, they need to have everything in with reference to the statement of work, each item, literally. And you were accountable for each of those items of statement of work. So it's you want to leave yourself a lot of time for that progress report. So it's definitely more time consuming. It's a bigger job than an NIH progress report.
That's good to know for me for next year. Thanks, Erin.
Sure.
So we have a question. Can we change the statement of work if we have results that change the hypothesis along the way?
Yeah, you can. There's flexibility. I would reach out to the program officer and speak with them, and then they'll guide you through that. I found that they were very responsive and continue to be very responsive, but it's like I said, it is more like a contract. So you do want to have that mindset. It'll be much easier for you as you move along with the grant.
I found the same thing when I was contacting the program officer. They were immediately answering my emails because I wasn't sure exactly how to word the changes, and they wanted the specific disclosure of this overlap in very specific language. So I'm looking at my statement of work now and I'm like, okay, I said I was going to create a REDCap database and I haven't started that yet, but I didn't get the money yet. So, I mean, that's coming in July, but now I'm like, oh, I better get that started. So it's easier. We've obviously started the project because we have a pilot on the same thing. But that's what I think. It's like you said, it's a contract. And I remember reading that you can change if somewhere along the process you find, I don't know, say you can't find enough women, or you might have to explain that in your progress note. I don't think that would change some things though, but even like in my statement of work, I have the statistical methods. Well, what if you change the statistical methods? Does that mean I have to write? I don't know the answer to that myself, so I would ask the program officer.
I mean, I think in this, yeah, I would literally ask them for guidance. It was easier than having it come back and it felt like a big task when it came back, literally rejected.
Yeah, I just kept asking, is this okay? And it was like, okay, this is okay. Now I can submit it. Yeah, and they're there to help. So they're very, very helpful.
Yeah.
A quick question, is there any allocation to indirect funds or is it only direct funds?
It is a federal grant, so it's in the United States. It is according to your institution contract with the federal government, the same as NIH.
Are you aware, is the statement of work peer reviewed or is it just for once the award is given?
I don't think it's peer reviewed, but it actually is. Okay, so it has to go in with the initial application. But I don't think the reviewers pay attention to the statement of work.
No, so I'm just trying to think. So I looked at my so I've had 2 of these and I looked, they were not mentioned in the summary statement, and I've reviewed for DOD and I don't remember reviewing that. I think there are 2 levels of review. Guys, you may want to correct me, but there's one that's there's 2 scientific reviewers and then what they call a consumer reviewer. And then there's another level that's, I want to say, without knowing the real word, DOD admin. And there they'll look carefully for the statement of work. And they do nitpick through it. So I've been asked, for example, they wanted for I have one of the Discovery Awards, which is like an equivalent to an R21. It's a little less money actually. And they wanted me to make my statement of work more precise. So I had to actually submit a new statement of work with a funded award pending. That's how that went.
We have a couple minutes left. If there are any more questions from the group. If there are no more, oh,
Sorry, I wanted to see, since there are no more questions, I wanted to share, I've asked Rob Wilson, who I've also asked to participate in the panel, and he couldn't, but for like 2 or 3 tips that he would give since he got the grant last year. Maybe I'll ask the panel if they have a couple of tips. So his tips were to check as many boxes as possible. And for him, it was ataxia, mitochondrial disease, and heart, I guess, from the topics.
Yeah.
To partner with great collaborators, and to cross every to dot every I and cross every T, because they're very detail oriented. Don't miss anything. So
Yeah.
those are his tips. So I don't know if anybody wants to add anything to that.
Yeah, I can add. So I had the first grant that I received was an R01 equivalent, and I got it on, so you can't, there's no resubmission process. So I got that one with the second submission. And the major difference was that I had a potential therapeutic component, which was the generation of a TAT fusion protein. And I'd included a collaborator who is, I guess, really one of the foremost people. And that was a very easy sell, even though it was a membrane protein, intermitochondrial membrane protein, which was quite risky, but that worked really well. So it was like basic with a potential therapeutic, you could say.
and last minute advice from our other 2 panelists.
Well, the impact is, well, because it was a discovery, but I think that, I mean, the DoD grant is always about impact, about on health of the military and, you know, the population in general. So that impact statement,
Yeah.
is extremely important.
Yeah, so actually just onto that, and then what Rob Wilson had written. So I was very clear what topic area that I was responding to. It was crystal clear. I even extracted it and put it in quotations, A, and then B, this impact. I mean, I did my reading for that. So I didn't just give some kind of words, you know, I really did. And I mean, I learned a few things, you know. So, you know, I think if you try that, if you do that, then if it's genuine, it's going to sound that way. Yeah. So, and the other thing I would say for the discovery, well, for both of the grants, I tried to make them very easy grants to follow. So I always put, this is, I guess, grantsmanship, but I put models into tables, and it was very clear what aims used what models, and just really, really, really easy. So that's just basic grantmanship.
Yeah.
Great. Well, thank you so much to all 3 of our panelists for joining us today and sharing your wisdom with us. As Liz said earlier, please don't hesitate to reach out to either Liz or myself if you have any questions. We'd be happy to try to answer them to the best of our ability. And also, we were told that the presentation that was given earlier today will be made available. So we're certainly going to share that with all of the registrants in our community. So thank you again to our panelists, and have a good afternoon, everyone.
I'm happy to make my email available to people if FARA wants to. Yeah, somebody wants to email me.
Great.
Yes, I would too. So thank you very much. It's a great panel. Thanks for orchestrating it. And hope everyone has a nice day.
Good luck to everyone.
Yeah, good
good
luck.
luck.
Now we got to get all that work done.
Thank you.
Bye.
Bye.
Bye-bye.
Bye.